One of the major topics when we get started in talking about weight loss surgery or diabetic surgery is how does this get paid for? I will tell you that in 2011 this is still a very stressful topic for many people. About half of people do have good coverage from their insurers. Every major insurer in the United States has policies that cover bariatric procedures. Some better than others, but all the major carriers follow evidence-based guidelines in the policies that they write that do have the coverage. Unfortunately, many businesses don't purchase those policies. They purchase policies that have an exclusion. That can lead to issues. Also, unfortunately, many larger self-funded organizations, such as hospitals, that claim to be evidence-based actually aren't even up to the 1991 National Institutes of Health criteria, much less the 2011. So they're more than 20 years out of date, and we are working very hard again with Obesity Action Coalition to try to mandate that this discriminatory practice ends. That being said, as an individual, I took it upon myself to pay out of pocket for my procedure. It cost, depending on how you do the accounting, over $15,000, and probably in terms of the travel and the pre-op workup and the medications, probably around $20,000 for me. And I had a few very lucky circumstances as well. But I think that's a reasonable cost to estimate what a sleeve gastrectomy should cost you. We are set here in Bellingham with a cash price at our outpatient surgery center currently at $15,000. That does not cover absolutely everything in terms of preparation with dietitian and psychologist. It doesn't cover all printed materials, but it covers the surgery very well for most people who have a simple procedure and are only in the hospital overnight. Again, things have to be individualized, but if you're looking at self-pay, that is a number to think about. Certainly if we have to do things in the hospital, it's very quick for prices to go towards $25,000 or $30,000, more for more complex issues, and because I cannot guarantee what the hospital will charge, there's some uncertainty regarding that. Because of that, I do try to avoid self-pay patients going to the hospital. Now, there are many people who think they have no coverage through their insurer, where they actually have partial coverage or even coverage they didn't realize, and we are here to help you with that. So I definitely don't want you to assume that you have no options in terms of having your insurer or your employer help out. I've also had many people have their family help them out as well, which is an option. I don't think that you have to worry in the beginning for most people in terms of getting a consultation. As long as you have comorbidities, most insurers will allow you to see a surgeon regarding that issue. If you have abdominal pain, if you have reflux, if you have a history of gallstones, certainly we can see you for that and also discuss preliminarily weight loss surgery. And of course our information session is free as well. Finally, regarding Medicare, I am a Center of Excellence surgeon from previously back in my practice in Duluth, Minnesota, both through the American College of Surgeons Center of Excellence certifying organization and through what's called Surgical Review Corporation, the two main Center of Excellence organizations. We are working to get that here in Northwest Washington, a couple of different places, and I am hoping within 6 to 9 months, if you have Medicare, we should be able to get your procedure covered with Medicare. Now, Medicare does usually require a 6-month preparatory phase, and so it is reasonable to come in and start the consultative process, start the workup, start doing the preparation, because evaluation doesn't happen overnight. Almost never does someone come in and have a procedure in less than 90 days, even if they have actually done all their work a few years before and decided not to go through with surgery. Just to get the ducks in a row takes between 3 and 6 months for most folks. So I encourage you not to delay if you have between coverage or anticipate coverage, it's perfectly reasonable to come in and start that process individually. Thank you. Another thing that many people don't realize about diabetic and weight loss surgery is that there is financing available. We don't have our financing completely finalized just yet, but I anticipate within the next 6 months that we will have an in-house company to do payment plans for at least half of the price of procedures. Now that will require, for most people, a cosigner and a credit review, so it's not an automatic payment plan, but I think it will be very useful for many people. We also do accept major credit cards, and we are working on ways for our finance company to work for Canadians as well. In Canada, for the province of Ontario, we had patients come down to Duluth with out-of-country benefits. There are some people who have come down to the Washington State area from British Columbia and from Alberta for various procedures. We don't have much experience with that yet, but I do have the out-of-country benefit form here, and we will work with your primary doc. I am happy to fill out the forms for your doc to be able to sign if they want to authorize that this is a medically indicated procedure. And I do know that the wait list in British Columbia is well over 18 months, and I think over 5 years in terms of gastric bypass, which is really the best operation, especially for diabetes control. So if you're interested in pursuing that, and you're resourceful and you're willing to work with us between your health authority and your primary physician at home in British Columbia, we will be happy to do our part. And I do go up to British Columbia fairly frequently for the University of British Columbia surgical grand rounds at Vancouver General, and have several relationships up there with providers. So hopefully we can explore this as part of our advocacy, not only to have people have surgery down here in the States, but also to help the University of British Columbia specifically pilot their program that they're having real issues getting resources during this recessionary time, freed up from orthopedic and cardiac services that always seem to have priority, even though they don't necessarily have evidence-based health outcomes to justify that priority.